This presentation is about tissue plasminogen activator, or TPA. This specific drug is used for mainly ischemic strokes, but there's also another kind of stroke called a hemorrhagic stroke. With an ischemic stroke, there's a few different things that can happen when those occur. The blood vessels are sometimes blocked, and that doesn't allow the brain to receive adequate blood supply. It can also be caused by a blood clot. So specific things can travel up into the brain and cause the blood not to be able to supply or get the adequate blood supply that it needs to survive. Then a hemorrhagic stroke is where an artery in the brain leaks blood. An artery can rupture and flood the brain tissue with blood. There's two types of a hemorrhagic stroke. There's intracerebral and subarachnoid. TPA is classified as a serine protease. It has essential components of the dissolution of blood clots, meaning it basically is useful to dissolve a blood clot. It catalyzes the conversion of plasminogen to plasmin. Indications for use are for the ischemic strokes, myocardial infarction or heart attacks, pulmonary embolisms, or thrombolysis. TPA administration, if you would primarily use these for ischemic strokes, you would not use TPA for hemorrhagic stroke because there's already bleeding going on in the brain, and the TPA would kind of initiate more bleeding to occur. So if the patient has an ischemic stroke, the TPA is administered via IV infusion. There is intracranial hemorrhage should be excluded before administration. Like I already mentioned, you would administer the alteplase as soon as possible, but within 3 hours of onset of symptoms. So if a patient came into the hospital and they were having stroke-like symptoms, they would have to determine when their last normal symptoms were. So if they had drooping of the one side of their face, or slurred speech, or just certain side of their face or body weakness, they would have to determine when their last normal situation was to determine if they could administer the TPA. It typically used to be within an hour, and now they've decided that you could administer it within 3 hours of the onset of symptoms. Then you monitor and control the patient's blood pressure. Here I pulled up some CT pictures of patients with these two types of strokes. The ischemic is on the left and the hemorrhagic is on the right. I perform CT scans on patients on a daily basis in my job as a radiology tech. And the hemorrhagic strokes, the blood always appears bright white, and then for ischemic strokes it appears that darkened color on the left. Sometimes when a patient had a stroke in the past and then they come back and we do another scan on them, you can see the old stroke areas. They also appear a little darkened. Here's a picture of a hemorrhagic stroke where it shows the artery is ruptured and blood is coming out of those blood vessels into the brain. And then an ischemic stroke is where you have it shows a blocked artery and a normal artery. So the blocked artery isn't allowing blood to flow up into the person's brain. So it's cutting off that blood supply and killing part of their brain. The mechanism of action, the alteplase binds to fibrin-rich clots via the fibronectin finger-like domain and the Kringle 2 domain. The protease domain then cleaves the ARG/VAL bond and plasminogen to form plasmin. Plasmin in turn degrades the fibrin matrix of the thrombus, thereby exerting its thrombolytic action. So it kind of shows the TPA, the finding the plasminogen, and then it goes to plasmin. And you can see the thrombus kind of down at the bottom, all these blood vessels kind of clotting together. So then it dissolves the fibrin, and then here's the degradation products, kind of where it is flowing out of there as more dissolved products. And then here are my references. Thank you.